Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please subscribe my channel and also please give your valuable comments. So your comments will help to modify my teaching. Please do give your comments. Now, as we know, we were discussing about a series of case discussion related to cough in children, and today we will have the last case in this particular series. Okay, so cough series we have already discussed about 12 to 13 cases. This is the last case, and these 13 cases what we are discussed, definitely I can make sure that these are the common cases that we will get in clinical practice. Once you know clearly about these 13 cases, almost 12 to 13 cases, they are the only cases which comes to you with a complaint of cough in your OPD. So a thorough understanding of these cases is sufficient to give a good treatment for the cough and also for the identification of the cough and diagnosis purpose. And also you can give a very good Ayurveda treatment once you identify the cause. So without the cause you cannot give, because in Ayurveda identification of the cause is very important before the treatment. Okay, so according to the cause we have to give the treatment, not according to the symptoms and not according to the disease. Now, this is the last case. A 3-year-old recurrent child with a recurrent cough, and there is no fever, and there will be an episodic nocturnal cough which is worst on running. This is the complaint of the mother. Okay, a 3-year-old child is there, complaint is recurrent cough is there, but there is no fever. So by this time you are now expert, isn't it? When there is no fever, what it suggests? When there is no fever, definitely it is not bacterial, definitely it is not viral. Okay, when there is no fever, definitely it is a immunological, or definitely it is allergic or atopic. So there will be episodic nocturnal cough. Episode, cough comes in episodes, nocturnal in the night hours, which is worst and running. Cough is always nocturnal, coming in episodes in the night hours, and this cough is worst on running. When the child walk fastly or run, this cough is more. Of course, there is no breathlessness, there is no tachypnea, breathlessness, etc. Family history of atopy is present. History of atopy is present. That is quite sure. Now the things are very clear. This is something related to allergy, no doubt. Now, they have given many antibiotics previously because it's a recurrent attack, no? So antibiotics, but there is no relief. Yes, antibiotic will not respond for allergic cough. Antibiotics respond very well for bacterial cough. So there is no use of even cough syrup. Yes, cough syrup also do not have any role. And almost all the tests, according to mother, all the investigations were done and it is normal. Okay. No fever with the episodic cough. There is no fever and only episodic cough. That's nocturnal it is. So this again indicates a non-infective cough, which is triggered by something, isn't it? It's basically allergic non-infective cough, okay, but it is triggered by running. There is some triggering factors are there. Cough is increased by running, okay. So history of atopy is also there. Now, this is actually a case of recurrent or persistent asthma. Okay, this is a case of recurrent or persistent asthma, which needs a long therapy. This needs a long therapy. Okay, so this may be probably 3 year of the child is having, so this may continue for 4 or 5 years also, and so this comes under the category of IgE mediated type of wheezing. There may be wheezing also. Okay, so this actually needs a long therapy. So asthma is common in 10 to 15% of Indian children. Okay, the commonest causative factors for this type of asthma in Indian scenario is carpets, pets, smoking parents, mosquito coils, then closed room, air conditioned room, poor ventilation, flowers, different types of toys, fur materials, okay, so which are acting as irritants. So these are most common in Indian scenario. So this is nothing to do with the external environment, even in developed in the, so that means we cannot say a polluted environment will cause like this. This is IgE mediated. So even developed countries also will have this type of presentation. So according to Ayurveda, we can consider this under the Vata Kaphajakasa, or we can also consider under Tamakashwasa. Okay, Tamaka Shwasa, and we have got separate list of treatment for Tamaka Shwasa that we will deal in separate classes, which is especially attributed for Ayurvedic understanding of kapha and its kasa and its treatment. So that we will deal in detail in coming classes. So this is all. Thank you very much. So this is a series of cases related to the cough approach in children. Thank you very much. I hope you enjoyed and you are benefited by these classes. So don't forget to subscribe my channel, and also please give your valuable comments. From the next class onwards, we will talk with another topic, and after few time again we will start with the after few days of gap. In between these days we will go for some other topic, and afterwards we will come with the cough Ayurvedic understanding of the cough. Okay, so please wait for that. Thank you very much, and please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.